everyone for joining. Going to get started in just a second. Okay, thank you everyone for tuning in to our second panel of the day on the future of cancer health disparities research as it pertains to the Black community. So I'm just going to give a brief introduction on Black in Cancer for those of you tuning in for the first time. Black in Cancer aims to amplify Black cancer researchers, clinicians, advocates, patients, and other cancer stakeholders. We are co-founded by Dr. Henry Henderson and Sigourney Bell. And I'd also like to take a moment and thank our sponsors, Tiger Lily, Fred Hutchinson Cancer Center, and Cancer Research UK for their generous support of our movement. I'd also like to shout out Dr. Henry Henderson and Dr. Wayne Lawrence for helping to create today's panel, as well as the content that you see on social media. So earlier today at 4 p.m. Eastern Time, we discussed the past and present of cancer health disparities research. Right now, we have a collection of talented trainees in a variety of cancer health related fields to talk about the future of cancer disparities research. So for the attendees, thank you for joining. And please feel free to type questions in the Q&A. We'll try to answer as many of them live as we can. And any that we're not able to address live can be addressed on social media afterwards. So tonight's panel is a quick 45 minutes. So panelists, please be brief in your responses. As well, attendees should post Q&A questions early on. So I'd like to introduce the panelists for today. So first is Dr. Wayne Lawrence. Dr. Wayne Lawrence is a cancer prevention fellow at the National Institutes of Health. He researches cancer epidemiology with an emphasis on minority and economically disadvantaged populations. Dr. Lawrence's research integrates epidemiological, biological, environmental, and behavioral approaches to better understand cancer disparities across the continuum of care. He completed his Doctor of Public Health, concentrating in epidemiology at the State University of New York at Albany School of Public Health. Dr. Lawrence? You're muted.
Hi, it's great to be here with you all.
Next, we have Dr. Arnethia Sutton. Dr. Arnethia Sutton is an NCI T32 Cancer Prevention and Control postdoctoral fellow in the Department of Health, Behavior, and Policy at Virginia Commonwealth University School of Medicine. Her research focuses on breast cancer disparities across the continuum. Dr. Sutton is interested in developing methods to improve genetic counseling and testing uptake amongst Black women at risk of hereditary breast and ovarian cancer. Additionally, she also seeks to understand the contribution of psychosocial and cancer care delivery factors on racial disparities in treatment-related toxicity. Welcome, Dr. Sutton.
Hey, thanks for having me.
And our last panelist is Porsha Thomas. Porsha Thomas is an MD PhD candidate completing her graduate studies at Mahiri Medical College, a historically Black college and university in Nashville, Tennessee. She graduated summa cum laude from Erskine College with an honors BS in chemistry and an honors BA in biology. She currently studies in the lab of Dr. Christine Lovely at Vanderbilt Ingram Cancer Center, and her thesis research focuses on auditing the immune microenvironment of small cell lung cancer in efforts to better stratify patients for immunotherapies. Her work also focuses on identifying racial and ethnic differences amongst African American patients with small cell lung cancer. Porsha is the recipient of a number of prestigious fellowship and grant awards which support her research. She has even been selected to give oral presentations on her work at the National Cancer Institute. Long-term, she plans on being a pediatric oncologist, focusing on the discovery of immunotherapies against pediatric brain tumors. Welcome, Porsha.
Thank you, Chris, for the introduction, and happy to be here.
So let's begin with a simple question, and we'll start with you, Dr. Sutton. What inspired your cancer research path?
Actually, I actually stumbled on cancer research. I'm a lab scientist by education and training, And when I finished my PhD, I knew that I was interested in community engagement, interventions, and disparities. And I met my PI in the weirdest way. She pretty much was like, oh, you did a PhD and you work full time and you have a family, so you're a hustler. So do you want to be my postdoc? And I was like, absolutely. And so she does breast cancer disparities. And she says, so you're going to do cancer disparities while you're here. And that's kind of how I stumbled upon it. That was about 3 years ago now, and I don't see myself ever changing fields. There's just too much work to do in this cancer disparity space. And I mean, like, I'm sure my the panelists and other people on the call, you know, after you start to learn about it, then you realize that these things have actually impacted your family, sometimes in ways you didn't know. So yeah, this is the space that I'm in now. I'm not going anywhere.
We're happy to have you. Dr. Lawrence, how about you? What inspired your cancer research path?
So for me, my interest did not really begin with cancer. I first started looking at health disparities, health inequities. Back in undergrad, I interned at a local health department. Local health department was located in a predominantly Black and Hispanic community, where rates of cardiovascular disease was highest within greater than the entire county. Lead poisoning was one of the highest in the state. Premature mortality was 5 years shorter compared to the neighboring city as well too. So during my time there, I had the opportunity to work throughout the community from things ranging from sex education to lead poisoning prevention and diet as well. But what really stuck with me is that one day as I was leaving to go out into the field as an intern, one of the community health workers looked at me and said, "Wayne, are you going out there?" I said, "Yeah, this is what I've been doing for the past month." She's like, "But it's not safe." And at that point in time, I realized that one, I was the only Black person there as an intern that was there to serve the entire community, as well as no one else in the office was actually going out into the community other than me and one other community health worker. These folks are being paid to help these individuals. So I realized that one thing public health needs they need more diversity. What brought me to cancer was during my my graduate education. I had the opportunity to work with a faculty member who did research on prostate cancer. And just from examining just how it disproportionately burdens Black males from cancer risk all the way to have the more aggressive forms of cancer. So just continue my work in cancer disparities research. The more I learned, the more passionate I became, and I just haven't looked back ever since.
Seems to be a common theme, here to stay. And Porsha, what about you? What inspired your cancer research path?
Yeah, so I will put out a disclaimer and say I don't consider myself to be a cancer disparities researcher, but I think my project over time has evolved to kind of include disparities research, which I think is perfectly okay. But if I had to, I guess, pinpoint an inspiration, then kind of like Dr. Sutton said, I would say just seeing things in my own family that were happening concerning cancer and knowing that outcomes could have been or should have been different than what they were. And I think, you know, we owe it to those who are less fortunate to help out when our platforms allow us to do so. So that's kind of why my research more so lately has started to involve disparities research, although I will say that's not my main focus, but I think it's something that I'm actively trying to incorporate more and more and more into my research endeavors.
Porsha, thank you for the answer. And it actually provides a great segue into the next question, which is, you know, as bench scientists, how do you incorporate, you know, thinking about cancer health disparities into your research? Are you able to work with diverse patient samples? Are you able to work with cell lines that are derived from a diversity of people? I'll start with you, Porsha.
Yeah, so that's a great question. And I think it's two parts. So I'll say yes and no. Yes, because I think the opportunity definitely exists. But knowing that that opportunity is, for my personal cancer that I study, it's very limited. So I study small cell lung cancer, which accounts for a smaller proportion of lung cancer diagnoses in general. So as a whole, samples are very limited. We do in the lab have cell lines that have been derived from African-American patients, and we do have a few tumor samples that have also come from African-American patients, but it's definitely by far not the overwhelming amount of preclinical or clinical samples that we have. So that said, we are actively working on changing that. And so we're currently putting forth efforts to diversify our preclinical models such as cell lines, PDX, patient-derived xenografts, and also tumor samples that we acquire. So there is still a lot of work left to do, but at least we're actively making steps in the right direction.
Yeah, that's awesome. And it's great that you can, bring your perspective to the table and basically say or advocate for the importance of having a diversity of samples. Dr. Sutton, in your intro, you mentioned that you were, trained as a bench scientist. So I'd also like to pose the question to you of how you think about, diversity of samples in the research that you were doing.
Yeah, so I would say I'm definitely the outlier here in that I'm not on the bench anymore. But in my role, we work very closely with bench scientists because we recognize that's where the gap is. And because we do community outreach and engagement and behavioral interventions, one of the things that we strive to do is to inform our communities on the importance of biospecimen. I find myself in a very, I'm grateful for the space that I'm in because of my training in lab scientists, that when I go out and talk to individuals about biospecimen provision, I can talk to them about some of the things that may occur. So, the different types, the different specimen types, and these are the different types of tests they may do. Even when it comes to like what the results mean, I'm able to talk to them about that. And so, I'm grateful to have both lenses now with regard to trying to bridge that gap between what we're doing out in the field and then trying to enhance specimen for our bench scientists.
Awesome, thank you. Dr. Lawrence, do you have anything to add on this point?
Yeah, I don't really have much to add. I'm not a bench scientist at all. I haven't touched a bench since undergrad, and that's when I realized it was not for me. I'm better with computers. But yes, I don't have much to add beyond what they've said.
So, related to this question of bench scientists, what we want to discuss is precision medicine and what role precision medicine could have in either, widening or closing, cancer health disparities gaps. So I'll pose this question first to Porsha. Describe how precision medicine is changing the game in cancer therapy and how this might affect disparities, if at all.
Yeah, so this is going to be another two-part answer. So I think precision medicine can be a good and a bad thing. I think it's great in the sense that I truly believe that personalized medicine is the way that we're going to overcome a variety of different diseases, not just cancer. Every human is very unique in their own right. Even if the human genome is 99.9% similar, people have different environmental influences that can cause them to be at increased risk for certain diseases. And so I think that it is great. Personalized medicine is great if it is inclusive. And so that said, I think that's when it can become a bad thing, is when your results aren't generalizable. So when you're not including underrepresented minorities in your researches, whether that's genomic studies or treatment studies or whatever, when they're not included, then that puts them at risk from being left out of treatments that might not ever have any benefit for them. And so I think that precision medicine is great when you have intentionality behind it to be more inclusive of people who might be more disadvantaged than others.
An excellent point. Dr. Sutton, do you have anything to add?
Well, I will say that the way that I look at precision medicine, yes, I think it's wonderful. I think it's a great direction. We're definitely headed in that direction. I'm all for like targeted treatments. We do need to, this is important. However, I remember a few years ago, it was precision medicine was along the lines of like people were talking about race-based medicine. And that's when I was like, that became very scary. So this is when we have to start thinking about how things are communicated, because if we're going to move precision medicine forward, then we need diverse sample types. We need that, samples from diverse populations. So we need to communicate that. But not only that, it's once we're able to roll out these type of like methodologies, then we have to be able to communicate to patients to let them know, like, this is why this type of treatment is okay for you. Because the questions are going to arise, like, why just me? Why not that person? And so while, yes, I'm all for us moving forward with precision medicine, that's definitely the way that we need to go. we really need to think beyond what's going to happen with the specimen and what's going to happen when they're, analyzing it, with how we're going to communicate this and how we're going to roll this out to our communities so that they're accepting of this.
Yeah, that's a great point. And I think that's a great segue to the next question that I'll pose for Dr. Lawrence, which is, how do we take what we've learned from our research and translate it into addressing cancer disparities? And what are some of the current barriers to that? So when we do develop, say, a new precision medicine, how do we get these things into the Black community, to heal our patients?
Yeah. So this question has two parts. With regards to precision medicine, as Porsha to echo what Porsha said, it is where we're heading, it's the way that we're going. But one thing that always stuck with me is access to. It all comes down to access at the end of the day. We see that from disease detection all the way to cancer treatment and so on. Black people in the United States are more likely to get poor treatment or more likely to experience greater barriers to treatment. We see this out of New York City when it comes to physicians even following up to patients after they have undergone cancer treatment. The follow-up time is much poorer as well. So precision medicine is wonderful, but I worry about accessibility to the best quality of care as well. To answer your other question with regards to translating research and how I'm doing that, that is a question that I sit with a lot. I remember when I published my first article, I was so excited. I'm like, yes, I did it, and I did it. It's my first paper. But in papers after that I was fortunate to publish, I kind of think the so what question. So what am I going to get out of this? How is this going to help improve the health of my people? How is it going to help improve the health of economically disadvantaged populations? And this is something that I try to sit with a lot, is ask that so what question, how would I be able to advance it? I think the current method right now, the current trend in how we must publish these high impact papers, I think it's okay, but it's not getting across what public health is all about, which is improving the health of the other people at the end of the day. So I think that there needs to be a lot greater focus in regards to service working within the community. So a lot of more community-based interventions, a lot of more community engagement, and a lot of more community involvement is the way to go to have a much more impactful outcome in our research.
All excellent points. Dr. Sutton, do you have anything to add?
Yeah, so Dr. Lawrence really touched on an interesting point. With regard to barriers in translation. And so the community engagement, community-based participatory research really only works well if you work with your community to translate and disseminate your findings. And so as he mentioned about, publishing in high impact journals, those days, we have to do it. If you want to get funded, if you want to get a job, keep your job, you have to do it. But I'm really grateful for American Cancer Society and other funding agencies now that challenge you about how you're going to disseminate your findings, because it has to go beyond our ivory tower. We have to work with our communities to decide what's the best way, what is the best way to present our findings to your community. And that is not necessarily generalizable all across all communities. And so I would say, even when we were talking about precision medicine, that right there, our communities are key, building and establishing trustworthy, sustainable relationships with our community is the ideal way for us to get past those barriers of making sure that we have adequate translation of our research.
Yeah, that's an excellent point, in that you have to really ingrain yourself within the community to see the things, manifest that you'd like to see. So Porsha, I'm wondering how you think about this question. I myself am a bench scientist as well. And I know that when you're doing, strictly biomedical bench science, it's pretty removed from any community. So how do you think about this question?
Yeah, so I think Drs. Lawrence and Sutton summed it up perfectly, but I think one thing to add is, like you said, as a bench scientist, you can often be very removed from, I guess, kind of the greater scope of the research you're doing. And so I think what helps, and this might be something that is just very unique to our lab, but one thing that I like is that we actually invite patient advocacy groups to come visit our lab. So we've had several lung cancer patient advocacy groups come and visit the lab. We try to keep patients involved in our research, and we have a pretty open lab door to where if they want to come at any point in time and see what research we have going on, that's an option for them. And I think that, kind of allows us to stay human and keep our focus on the fact that our research is for patients. And I think, especially as a graduate student, you have to be very focused because, you just want to get your PhD and finish. But I think you have to realize that even the work you're doing at this level can be extremely impactful. And it's a stepping stone for work that you'll do in the future. So I think if you can form habits of keeping patients in mind now, then long-term that will benefit you.
I like that idea of just forming the habits of keeping the patients in mind. All right, so we're gonna actually switch gears a little bit and be a little introspective. So the next question is, do you feel that your respective institutions authentically engage in cancer health disparities research, as well as diversity, equity, and inclusion work? And what areas could be improved upon? We'll start with Dr. Sutton.
I'm so glad you started with me. So yes, I have the honor, I work at VCU Massey Cancer Center. So I have the honor of working for the only NCI designated cancer center that has a Black cancer center director. And my PI also happens to be the chair of a department in the School of Medicine, and she is a Black woman. And they are true to this, if I can say that. They walk the walk, talk the talk. Disparities is a focus of our cancer center. It's a focus of the department that my PI chairs. Everything we do, it has like a disparities lens, a disparities question, like methodology, like that's always considered. I mean, we always want to think about ways that we can improve. And so one way that we are working to improve, which Porsha made me think about, is how we look at disparities as cross-cutting, but across basic scientists, across behavioral scientists, but we don't really do a good job at that. We don't really do a good job at like getting out of our little silos of our research types and working with other individuals to try to make disparities across the board. And so I will say that that is one thing that our cancer center is working on, that we can do a better job at.
And I'd just like to ask a follow-up question of, what impact do you notice this has in the Black community that might be around you, this type of representation that you have at the cancer center, or maybe with the patients or something like that?
Yeah, so recently I have met with a few people out in our communities for something that we're working on. And it's wonderful to hear people always tell me like, oh, our cancer center director, Dr. Wynn, it's so nice to hear him on the radio stations, or like he talks to some of our faith leaders every Friday and they just have these very like candid conversations about what's going on with COVID and what resources are available. Or, the fact that, oh, it's so dope that you work for a Black, PI and she's a chair of a department. And so I think, in our community, like my community here in Richmond, like I think that's palpable now. Like people are seeing that and they're seeing that work is getting done and people are speaking out. People in high places are speaking out in ways that they haven't before. And I think that is, it's like a breath of fresh air for some of us who have been here for a while.
Yeah, and I really like how you said, people in high places are speaking out like they haven't before, which really just touches on how important it is to have a seat at the table and a voice at the table. So I'll also pose a question for Porsha. Do you feel like your institution really engages in diversity, equity, and inclusion work, and what needs to be done to improve upon it?
Yeah, so Chris, I'm gonna take a second to shout my school out, Mahiri Medical College. And if you're in the chat and if you're watching this, I want y'all to drop your names in the chat if you go to Mahiri, because Mahiri, being a historically Black college and university, the main mission of Mahiri is to address healthcare disparities. So whether that's in the clinical enterprise or the research enterprise, we have a slogan, serving the underserved, and I can say that that is definitely the main mission that permeates all of Mahiri. So I think I'm very fortunate to be at an institution where we don't really have to think about how we're going to perform healthcare disparities or do research on healthcare disparities or what type of populations we're treating. The whole mission of Mahiri is to do exactly that. So if you're in the chat and you're from Mahiri, go ahead and drop your names and let's rep Mahiri.
So while the chat is blowing up, Dr. Lawrence, I saved you for last because I understand you work for the National Institutes of Health, but maybe posing this question of what do you think government could be doing to improve our efforts? Yeah.
You're trying to get me in trouble. So So I just started here. I can't really speak for my current institute, where I am now. I could say that for my previous institute at a School of Public Health, out of 5 total departments, there was probably 1 full-time Black faculty. So I just want you to think about that environment right there. So what I could say is that I was able to find mentors outside of my school, with the side of my department. So I depend a lot on faculty members at other institutions, at other organizations, and I was helped with AACR for connecting me with a lot of folks as well too. But within my institution, even though they claim to be diversity, equity, they posted the blackout photo to show to discuss regards to like violence that we experience in the Black community. I just remember so many toxic experiences that I've encountered. I remember sitting in one class. We're talking about cancer disparities or so on, and the professor referred to us Black students who all got together as colored. I remember just there were just so many different I'm grateful for the education I got, but it was very taxing. So within my institution, I can't say that I truly had that authentic mentorship experiences. I could say that I'm grateful for the Black students that were there, because we all kind of huddled together and said, all right, how can we do this? How can we ensure we get this postdoc? How can we ensure to get this job? So I can't say that I had a truly successful mentorship within my institution, but I'm grateful for those that took me on their wings at other institutions. But it's a life that often occurs at PWIs.
Yeah, and that's, why we have Black in Cancer, so that, we can be the ones to combat this and control our narrative. Okay, so we have a question from the Q&A chat. Considering the current and historic nature of scientific racism, what are some practical methods around bridging the gap between biomedical research and community? So we've touched on this a little bit. Maybe Dr. Lawrence, if you want to expand on, what we've discussed so far.
Sorry, so could you repeat that one more time? Okay.
Yeah, so considering the current and historical nature of scientific racism, what are some practical methods around bridging the gap between biomedical research and community?
Yeah. So this is something that I think about when it comes to my research as well too. It's to take into account, so when I work on a population level, it's taking into account what has happened historically, such as medical mistrust and just everything that's happened as well too. So when I develop a question, I develop how would it serve the community. Not just develop a research question I find it to be interesting or that see to have a high impact in the journal, but to think about how would it truly serve the community. And then from there, I will go back and see what could be done to resolve this issue on the biomedical end.
Dr. Sutton, do you have anything to add?
Well, I think there are definitely some structural things that can be done to help, this problem that we have. And so I will say some of the things that we've done, we have within our state, we have 2 cancer research and resource centers that are in rural areas of our state, and they're staffed by community members that are trusted in their communities. And a lot of our investigators and researchers, they work with those centers before their projects are even launched into the areas. And the great thing about having those centers too is that they work with a lot of the community stakeholders in their area. So everyone knows if there's something cancer related, it's in their community, 100% of the time it's gone through one of our cancer research and resource centers. So it's kind of been vetted. One of the other things that we've done too is, there's always this, I hate it when people say, oh, Black people don't want to do research. Not true. We had a group in our cancer center called the Breast Health Research Champions, and these were women that were breast cancer survivors that were interested in research. So they came into the cancer center, they toured the tissue data acquisition core, they learned from some of the researchers there, and then they were able to go back out into their communities and teach their other survivors in their communities, sometimes in their own homes, about what they learned about clinical trials, about biospecimen, about research in general. And that was one of the ways that we try to help bridge that gap between our biomedical sciences and what's going on within our communities.
Yeah, absolutely awesome work. And then Porsha, if you also want to address this question, and maybe you could also address it in the sense of recruitment and how, we can do outreach in communities so that we can actually, widen the pipeline as well.
Yeah, so I think one thing that can help is oftentimes we have to take ourselves off of the pedestal that individuals put us on. And so as individuals who are pursuing higher degrees, oftentimes people feel like there's a huge gap and where we are versus where they're at. And it's really not. And so we kind of have to bring ourselves to a place where we can have humility and enter into the communities and not just, like Dr. Sutton said, stay in our silos. So I know that for the past few years, I've done a program through Vanderbilt called Scientists in the Classroom, which allows me to be in the classroom of elementary and middle schools that have high underrepresented minority populations. And I think having that early exposure kind of not only allows them to see that they can potentially do what I'm doing one day, but it kind of normalizes interacting with individuals who might be scientists or physicians. And so I think there's often fear when patients go to the physician because there's a lot of mistrust within the Black community that, you know, has been because of years and years of things that have just been done so wrong against us. So I think you just have to, those of us who are in the space have to put ourselves back into the community and not get to a point where because we have these degrees or because we have this education, we're too good to, you know, go back in our communities and talk to people who really need us the most. So I think for me, just always doing community outreach, always making myself visible, and whether that's, you know, in person or in social media, it really doesn't matter, but making yourself accessible to people so that they can essentially become more educated about certain things. But other than that, I think what Drs. Lawrence and Sutton said were perfect. I mean, there's a lot of trust that has to be built up. There's a lot of years of mistrust that have to be undone. And so, you know, it's a baby step process. And I think it starts with us just doing everything we can to help build that trust back up.
Yeah, you made excellent points about trust and, you know, putting ourselves on a pedestal. And I think it really segues into a question that we got from the Q&A chat, which is, how do you suggest holding conversations with Black cancer patients regarding enrolling in research and clinical trials? So let's start with Dr. Sutton.
My number one answer is going to be patient advocates and patient experts. I mean, so one of the, you know, you mentioned earlier, one of the individuals who are contributing to this Black and Cancer Week, the organization is Tiger Lily Foundation, like filled with amazing patient experts and patient advocates. And really, it's for us, if we have certain resources, they have certain resources, we have expertise, they have expertise. We have, and then the difference too is that we're learning and writing about it, and many of us have not had those experiences that other people need to hear about in order to really, you know, galvanize individuals to be a part of, you know, research or clinical trials. And so we have to work with individuals who have lived certain experiences in order to even develop methods to enhance clinical trial participation.
Yeah, definitely a shout out to Tiger Lily. So just in the interest of time, I'm going to try and get through some of these questions. We got a couple extra questions in the question and answer. And I'm not trying to get you in trouble, Dr. Lawrence, but I do think that this is a question that's best answered by you. How do you maintain the balance with doing the work around disparities and not being too political in the process?
I recently wrote an op-ed right before coming here to my current institution about that public health is political. When it comes to, as you see now with COVID-19, it is very political. It always has been political, just that now it's more than ever. When it comes to research, I try to be as authentic as possible. A lot of my research is driven around centered on cancer health equity, more importantly, improving the health of Black folks. I try not to, I guess I am political. I try not to be political within my research, but I understand that politics is very important. So I do a lot of advocacy work. I know that funding is important. So I'm not sure if I'm answering the question correctly, but it is, politics is involved at the end of the day. When it comes to funding for grants, people go to Capitol Hill and lobby for that, which at the end of the day lobbies for increased NIH funding, which allows for a higher pay line. Politics is involved every step of the way. So you cannot be too void of politics, because at that point, the vulnerable people are the ones that are impacted the most.
Yeah, I mean, seems like the short answer is you can't, right? You can't keep politics away from disparities because it's ultimately social factors that are leading to these disparities in the first place. And then there was another question in the chat regarding funding around disparities research. I think, hold on a second. Where did it go? Yeah, so basically, oh, I'm sorry. We're gonna switch to a different question, I apologize. So how important is cancer education in the Black community? And we'll start with Dr. Sutton.
So I think, cancer education is like salient to what the work that we're trying to do. And especially around prevention. I mean, as they discussed in the webinar earlier, when we're talking about all of these different cancers and risk factors, we're talking about overweight, obesity, we're talking about smoking, we're talking about alcohol. We know there are some environmental exposures. And so and then of course the big one is screening. And so all of these are opportunities to educate our communities, but we have to, if we're really trying to work on addressing disparities, and even with regard, a lot of times we talk about mortality, but if we want to talk about even incidence, then we have to start thinking about these risk factors and how we can adequately educate our communities about them. And then what resources we can bring to our communities so that they can they can actually live out some of these. So if we're talking about eating healthy and there's nowhere to eat, then we're doing our communities a disservice. So like Dr. Lawrence said, this is political because we do have to consider policy, but it is our job also to educate our communities on how they can be healthier.
And Porsha, I know you touched on this question before, but if you just want to expand on, the importance of cancer education in the Black community.
Yeah, Chris. I think it's super important, and I mean, being educated for any patient who has cancer is important, but especially for vulnerable populations like the Black community. And so I think there are a lot of cancer myths that tend to permeate the community, and these myths create barriers in people receiving adequate diagnoses and receiving the optimal care. And so unfortunately, the system we have in the US kind of forces patients to be their own advocates, especially when it comes to things like cancer. And so you have a situation where physicians are very limited in the time they can spend with patients because they're paid based off of how many patients they see in a day. And so once they walk into the room, a patient really just has to start advocating for themselves. And so I think Dr. Sutton mentioned the importance of having advocacy groups for patients, but I think in order for you to properly advocate for yourself as a patient, you have to be educated. And it's tough because I mean, there's a lot of nuances to cancer, and you really do have to have a good understanding of it if you have a physician who's not willing to take the time to make sure that their patient understands that. So given that the system itself is not really in favor of patients in general, but specifically Black patients who are already at a disadvantage with even just receiving proper access to care, then it's super important, because that becomes a matter of life and death, literally. It's a matter of, if you're educated, you might receive a timely diagnosis. If you're educated, you might be put on a clinical trial that can improve your outcome. And so that's definitely an area in which we need to improve. And I think the community involvement piece is super important. And, the work that both Drs. Lawrence and Sutton do are just as important, if not more important, than the bench science. I mean, the bench science gives the results, but those results, like Dr. Sutton was saying, have to be communicated to patients in a way in which they can understand it, and in a way in which they can advocate for themselves properly.
Absolutely. Dr. Lawrence, do you have anything to add for this question?
Dr. Sutton, Dr. Thomas summed it up perfectly. At the end of the day, cancer education is critical when it comes to disease prevention and early detection. But beyond that, when it comes to treatment decision-making, it is best cancer education is important to inform their patient or their family members on important treatment decisions and what they will experience with regards to each decision as well too. So throughout the entire, from early detection all the way through adjuvant treatment, cancer education is crucial.
Absolutely. So we're going to be wrapping up soon. I just want to finish with one question for all of our panelists. which is basically if you have any advice for undergraduates or high school students who want to see themselves in your position. So as an MD PhD candidate, let's start with Porsha.
Oh, don't do what I did, but no, but stay the course. The journey will be long, especially longer if you want 2 degrees. But I think somebody once gave me some really good advice, and they were like, at the end of the day, time will pass anyway. And so what you decide to do in that time, it's up to you. So when I started medical school back in 2013, it looked like a really long journey. And here we are 7 years later, and that journey is almost over. So those 7 years are going to pass regardless of whether I was working on my doctorate degrees or not. So I think the best advice I can say is stay the course, be very kind to yourself, take care of yourself, give yourself a lot of grace and a lot of forgiveness, and just find your passion, because it's going to take passion to push through some of the rough times that you'll experience in medical school, graduate school, dental school, public health school, wherever you want to go. It's going to take passion to really make it through those tough times.
Absolutely. Dr. Sutton, any advice?
My one piece of advice is that mentorship is key. And I don't care if it's someone in your neighborhood that always like boosts you up and tell you you can do this and push you. If it's a professor in undergrad, whoever it is, align yourself with someone that's going to always have your back and someone that's going to always push you, because this journey is difficult. Many of us, I know I was first generation, so even trying to explain to my family why I'm in school for so long became a little arduous. But having people that knew what was going to happen and was able to help me along is key through your whole career. It's going to be key for a good mentorship.
Absolutely, mentorship is so important. And then Dr. Lawrence, any closing words for us?
Yeah, I agree with everything Dr. Sutton said and Dr. Thomas said. Like mentorship is truly key. That's how I got to where I am. I have a mentor here now at NIH that I work with through my master's. And he was one that he made this possible for me. He was one that kind of helped me when I was up against my back against the wall, that I know what to do or just was very uncertain. So mentorship is the most important part. But also I want all those that are underrepresented to know that you do belong and it is possible. Like, look at us here right now. This is very doable. If you have any problems, any questions, just feel free to reach out to me. I'm here, I understand. Know that you do belong, and find a mentor, someone that's willing to advocate and fight for you.
Yeah, that's a great way to close. And with that, I'd just like to thank, all of our participants. We had over 100 participants in our webinar today. I think there was a lot of mahiri Medical College representation in the chat. I also just want to thank our panelists, Porsha Thomas, Dr. Arnethia Sutton, as well as Dr. Wayne Lawrence.
Thank you.
Thank you.
Thank you.
All right. Thank you, and have a good night.